everybody, and welcome to another week of Ask Dr. Leila podcast, where this week we're going to delve into a topic that affects essentially the whole globe, and not just dental professionals, any professional. And we're going to have Dr. Batria here with us, our special guest this week, our conservative dentist, our root canal specialist, who's going to delve into this topic a little bit more for us. Welcome, Dr. Anu.
Thank you. Thank you, Dr. Leila. Happy to be back here at this platform. Yes, I'm very excited to touch and go through this topic because it has an important impact into our dental professionals, and it involves the well care that we provide to our patients.
Absolutely. Could you delve into what is the definition of burnout?
Absolutely. Burnout is a psychological problem that comes due to chronic stress. It leads us through exhaustion and some negativity and some cynical attitude that makes us, burst into our staff, our colleagues, and even into ourselves. We end up being in a negative cloud.
That's when they say that we feel like there's a cloud over us. You know, that's probably the feeling they're referring to. So I would assume that burnout and stress could be interchanged, or which shouldn't be. It's confused for people as to what is which one, and when do they feel, is it stress or is it burnout? Could you elaborate on this for us?
Definitely. Well, although they are interrelated, they are very different concepts. So when we talk about stress, there is a hyperactivity due to the development of a changing situation. Regardless, burnout, it produces like a sensation of helplessness, causing a situation of breakdown when this adaptation situation happens. So burnout is much more than a stress.
Okay, so it's stress plus more.
Yes.
Would you say? Is
Yes.
that a good
Yes.
definition?
Exactly.
And as a dentist, I will ask, what is the signs and symptoms for dental professionals?
Well, it's a sensation of being drained out. Exhausted, even if you have rested. You start feeling detached from patients, from staff, from you yourself. You are never satisfied, even your task is accomplished. You are irritated, you are angry. So there are many symptoms that we can diagnose, or our colleagues in the environment can see around it.
And why is dentistry such a high-risk profession?
You know this. Dentistry combines a high physical, emotional, and mental demand. We are under some time management, long appointments, tight schedules, emergencies. We are dealing with patients that some of them, they have fear, they are nervous, they have a high expectation. We are very perfectionist, so that does not help. There are many more. It's something that causes our self-esteem in a very low position.
I always say OCD, and I used to say it with pride. But as I kind of aged and got more experience, I realized this OCD is not necessarily a good thing to have. And for me personally, the OCD does carry home. I personally have an issue with kind of drawing a line. Where is, my work and where is my home life? And having raised 2 boys, being married, having a life outside of this life, that has not been very helpful, to be honest.
I understand.
But the signs that dentists can look out for is, I think you've already mentioned it. If you can say it again.
Yes, it's like the dentist. I'm talking about dentistry, but this can be related to any specialty. The person is not focused, is out of the bloom. Physically, you can even stop taking care of yourself. You're not eating well. Basically, it's like a bubble of negativity all around.
And back to the OCD, for me again, I feel that almost, I can say, nothing is good enough. There's always that little increment I could have done more. Never the satisfaction where this is great and, I should be proud of it. It's always, I'm demanding myself a bit more. But then that also goes with my character, where I wake up every morning pushing myself to be a better version of who I was yesterday. And I know I'm going off topic, but challenging myself as well. I think that challenge at some point catches up with us. I mean, how much do we want to keep challenging and challenging? I tell myself, Leila, start living and living. Don't just challenge. So I understand, what you say. So the consequences of burnout for dentists and their patients would be, again, how do patients actually feel this?
Yes, of course they feel it, because the professional, the physician is not focused. It's not caring. It's not in the path he should be.
Is that where I've always heard? I mean, I get these comments where you're such a cool dentist and you're always smiling. Oh, this is what I get a lot. You're always smiling and happy. Very few dentists in our lives, the patients say, ever were like that, because our dentists usually were, and I've heard that, were angry, and they go, you talk so nicely to your staff. This is really unheard of. So this is because most dentists do have anger management issues, I would assume.
Yes.
I mean, it was new to me when my patients told me that that's what their experiences were, but now it makes sense, So we have to work on ourselves, because
Definitely.
they see everything that we, So, and strategies, what can we do?
This is the point I wanted to touch. So there are some efficient strategies in which we need to work. So the first would be to manage the stress. The ideal is something which is in all the topics. Practice mindfulness, be present, practice some yoga, some meditation. Apart from that, we need to create a positive environment in which we have an open communication. We need to seek for help. Out there, we have an excellent professionals, peers, mentors, coaches, that if we need them, we need to approach them. Apart from that, it's going to sound funny, but we need to promote the continuous learning, because the fact that we are curious, we are learning other skills, other techniques, make us feel much more passionate about our profession or our daily dedication.
And I think you guys all saw that in me. Actually, we were in a 3-day conference. So we just finished that with CAP. It was such an honor. And since we've come back, and I can't wait to share with you guys, I'll be sharing some topics in these coming weeks. But it's, first of all, change is important from our routine life. And I feel like, day to day, we need to bring something that's a bit different.
Of course.
For dentists especially, really, I think there's not a magic number, but and I'm just saying these things from the top of my head, but I think every 2 months, just taking a little weekend getaway is good. Talking to your peers, no matter what profession you are in, is really important, because then you realize you're not the only one. And sometimes, that pity that we feel for ourselves, that's the worst thing, self-pity. So once you start talking to other people, you're like, wait a second, I'm not the only one. In a way, it makes us feel better.
Yes.
Does that make sense?
Yeah,
I know
definitely.
it's funny in that way, but and positive work environment, which I've really tried to encourage here at LH. I think you can attest to that.
I agree with that. I always come with a smile when I come to work.
Oh, that makes me feel so much better.
I have to say that. I want to add one more thing, Leila. We need to balance our work and our life. So that means if we need to take a break, we should take a break, and we need to settle our boundaries. It's very important. It's very important.
100%. And priorities.
Exactly.
Sometimes I want to do it all. Again, I'm talking about myself. There is no, this is priority, then this. It's like, if it's in my book, it needs to be done. And that's wrong. I mean, we all, we need to prioritize and give more attention to something that's more important. And if it isn't, it's okay, and let your mind sleep at night. Don't let it just go jumbling on and on and on.
I will say not to multitask.
Not to multitask. Very good.
I wanted to ask you something, if you allow me, Dr. Leila. Have you faced this situation, or better to say, would you give a tip to our listeners, as long as you're an entrepreneur and you have much more experience than I have, something that our listeners can take along?
Okay. Yes, I have multitasked, and more so since I've opened my clinic, obviously. It is huge. It's underestimated until you do it. But I don't regret it one bit. I have to say that. There's times it's not easy, but I have a passion for what I do. So I think being passionate in whatever field you are creates success. And I always say that to young people in my chair. I'm like, whatever you choose to be, make sure you're passionate about it. Because once you're passionate, The rest of it is not like work. It's almost like you're just doing something that you're passionate about. But of course, I go home, I have two teenage boys. Well, one is already off. I think, especially the last few years when I've opened my clinic, I do much more yoga than I ever did. As you mentioned, I do walking, and walking is very therapeutic. I swim. I feel these all are, I used to be runner, like I'd like to go to the gym and run, or I'm not sure if that really quiets my mind, running. I might feel the endorphins, the adrenaline rush, but it doesn't quiet me. So I'm trying to do more things that quiet me, reading a book, and more than ever, podcasts, because just that education makes me feel that I'm on top of the world. Any little bits and pieces I can get from, the big people in the world helps me.
Bravo.
So that's what I do.
Nothing to add anymore.
Thank you so much, Dr. Anmol.
Welcome
Yes.
anytime. I would love to give an insight as a brief. So burnout is challenging. We need to acknowledge it. We need to seek for help, and we need to provide positive changes. So that's the only way we can take care of our well-being, and that's the time we can provide an excellent care for all of you guys. Thank you. Thank you so much.
Absolutely. And remember, mental health can be more important, and actually I think is more important than your physical health. Sometimes we really do overlook it. We're like, okay, we have to go to the gym, we have to do this, but do think about your mental health. Thank you to our listeners for listening, and until next time. And don't forget, if you are interested to be on my podcast, reach out to us. Have a lovely day, everybody.